Before we had compassion, we wanted to take care of these people because they were unfortunate, they got sick. Now it's more of a frustration and fatigue because we can prevent it and we're still not preventing it.
We just wish people would understand the frustration that we're seeing.
It is being called the pandemic of the unvaccinated, and some healthcare workers are struggling to stay compassionate. Their frustrations boiling over as our local ICUs fill to the brim. Brooke shares what it's doing to people who we rely on the most during our sickest days.
They're in overdrive and understaffed.
It's tense right now, and it's just nonstop.
Battling the unpredictable.
You may have somebody who has absolutely no symptoms and somebody who's just dying.
There's more death this time around than there was in the first wave. The patients are younger. The patients are sicker.
The hospitals are full. The beds are full. We have literally no ICU beds at this point. We are actually transferring people where we can get a bed.
That's the reality at Norton Women's and Children's Hospital.
The last few months, nothing compares to what we've experienced and seen.
Just ask the nurses.
I have never been surrounded by so much death.
The respiratory therapists who are at their side.
There have been moments that I have left the ICU room crying.
And the physicians.
This is going to be my 13th nonstop day.
They try to stay upbeat.
But sometimes that's hard to do.
Sometimes you just have to take a moment, kind of collect yourself, and just kind of motivate yourself to go back and keep going and do it again.
Most of them are on the ventilator, all over something that could have been prevented, a simple vaccine, wearing your mask.
Comparing numbers in our local ICUs, vaccinated versus unvaccinated, it's not even close.
And then they argue with you still that this disease is unreal. The vaccine is something that's going to track you down. It makes no sense.
We have had a few patients who have expressed that they wish they would have done the vaccine, but by that time it's too late.
When they're gasping for breath and they're begging for you to help them, we give them every treatment that we have, and sometimes they just don't work.
The reality is the drugs used to treat COVID are more experimental than the vaccine and may only work for half the patients.
You're seeing the people that you're getting ready to intubate call their loved ones for the first, last time maybe, to say I love you before they get intubated. And you know, at that moment, the odds are stacked against them on the ventilator.
Everyone has at least one case they'll never forget.
I have the names and the images of all my patients I have lost since the beginning of COVID burned in my brain. I remember what bed they're in. I remember what they look like when they passed and what they look like before. And it never gets easier. And you know, you just want those people to be able to make it off the ventilator. So when we do have success, when we do have people that make it off the ventilator, it's a celebration because it's not very often that happens.
In Louisville, Brooke Hash, WHAS 11 News.